High blood pressure, also known as hypertension, is when the force of blood pushing against the wall of your arteries stays consistently too high. This extra pressure forces your heart to work harder, and over time it can lead to serious problems like heart attack, stroke, kidney damage, and more. Blood pressure is measured using two numbers. The top number, called systolic, is the pressure when your heart beats. The bottom number, diastolic, is the pressure when your heart rests between beats. A normal reading is about 120/80. If your number reaches 140/90 or higher, that's when you are officially considered to have high blood pressure. Here is something surprising. 95% of all hypertension cases are classified as essential, primary, or idiopathic, which simply means the cause is unknown. Doctors don't know exactly why it happens, but they do know how to treat it with medications. That's been the standard approach for years. But what if there is another way? A growing body of research suggests that the real root cause of hypertension can be understood and even reversed through natural, inexpensive methods. Some of these can lower your blood pressure rapidly without a single pill. Your blood pressure is regulated by tiny sensors in your arteries and veins called baroreceptors. These act like pressure gauges, consistently monitoring your blood pressure and sending signals to your nerve system, specifically the autonomic nervous system. This system has two branches: the sympathetic, your flight or fight mode, or parasympathetic, your rest and digest mode. When the system is balanced, your blood pressure stays stable. Most people are told to reduce salt when they have high blood pressure, but the relationship between sodium and hypertension is more complex than you might think. Yes, excess sodium can raise blood pressure, causing the body to hold on to water. But a sodium deficiency can actually impair baroreceptor function and stimulate the sympathetic nervous system, which raises blood pressure. So while you might see a short-term drop from cutting sodium, it may weaken your body's long-term ability to regulate pressure, especially if you are also low on other minerals. The key mineral is potassium. It plays a vital role in balancing sodium levels and keeping your body vessels relaxed. Most people don't get enough. The recommended daily intake is 4700 milligrams. That's the equivalent of 7 to 10 cups of vegetable a day, yet very few people hit that mark. A potassium deficiency called hypokalemia has hypertension as one of its key side effects. So if you are only focused on cutting sodium but ignoring potassium, you might be missing the real fix. Another underrated factor, vitamin D, it helps regulate the autonomic nervous system, especially the calming parasympathetic side. Many people with high blood pressure have low vitamin D levels. Just fixing that deficiency, whether through sunlight or supplement, can have a noticeable impact on blood pressure. Now here is where things get even more interesting. Insulin, yes, the hormone we usually associate with blood sugar, also influences baroreceptor. While high insulin is linked with hypertension and metabolic syndrome, some treatments actually use insulin to lower blood pressure. But the real issue isn't insulin itself, it's insulin resistance. That's when your body becomes less responsive to insulin, and it's a hallmark of metabolic syndrome. And what fuels insulin resistance? Sugar and refined carbs. Not only do these spike insulin, but they also deplete potassium, creating a double hit to your blood pressure control. So what's the solution? Here are the most effective steps you can take starting today. Eat more potassium-rich food like leafy greens, avocado, and sweet potato. Cut down on sugar and refined carbs. Consider a low-carb diet. Get enough vitamin D through sunshine or supplements. And now the technique that can instantly lower your blood pressure, paced breathing. This involves slow your breath down to 6 full breaths per minute. This rhythm actually synchronizes with your baroreceptor, helping them restore balance and lower pressure. Here is how to do it. Sit comfortably, breathe through your chest, not your stomach. Inhale slowly through your nose for 5 seconds. Exhale slowly for 5 seconds. Repeat this cycle for few minutes. 6 breath per minute is the goal. Don't strain. Straining triggers the sympathetic nervous system, which we don't want. Just breathe gently. Do this few times a day while driving, resting, or even before bed. High blood pressure might be common, but it doesn't have to be permanent. With the right nutrients, better breathing, and smarter diet, you can take back control of your health naturally. Thanks for watching. If you find this content helpful, give a thumbs up and subscribe for more exciting science content.